In his book, The Paradox of Choice, Barry Schwartz explains something beautifully ironic. The more choices we have, the more confused, regretful, and anxious we become. Sometimes, clarity comes not from having more options, but fewer, better ones. These days, we have options for everything: clothes, furniture, education, even which doctor to consult. In India, you can literally shop for doctors, swipe left for orthopedics, swipe right for gastroenterologists. But too many choices can jam the brain, like trying to pick one biscuit from a shelf of 47 varieties. Even in healthcare, some conditions come with a buffet of treatment options. Doctors can get overwhelmed, patients even more so. But gallbladder problems, thankfully, they are refreshingly simple, limited options, minimal confusion. Let's dive into the treatment choices for gallstones. Hi, I'm Gaurav and you are watching Gut Instincts, where we cut through the clutter and get to the guts of the matter. Let's explore the different treatments for gallstones that are currently available. First, gallstone treatment depends on two things: whether we have symptoms, whether there are complications. Let's break it down. No symptoms. Ultrasound has become so routine. It's almost like checking your phone for notifications. And thanks to that, a lot of people discover they have gallstones without even trying. A recipe for confusion. Because suddenly they are googling things like, do gallstones mean I am dying? Or can I poop them out? Here's the truth: if those stones aren't causing any problems, we usually don't treat them. No meds, no surgery, just a calm, informed shrug. It might sound odd, I know, but these stones are just bile chemicals that decided to settle down. They are not rebels, they are like parked cars in a no traffic zone, just sitting there, not honking, not moving, not crashing. Life threatening symptoms aren't the onboarding experience. Gallstone symptoms begin with a soft notification, not a system crash. Most symptoms, if they show up, start mild. But, and this is important, patients with asymptomatic gallstones need to be educated, because if symptoms do appear, they should know when to act before things escalate. Our video, Symptoms of Gallstones, will help you understand more about this. Now, there are a few select cases where surgery is advised, even without symptoms. But that's a story for another video. That video is coming next. So if you have gallstones and no symptoms, don't panic. Just stay informed, stay observant, and stay tuned. Coming to uncomplicated symptomatic gallstones. These folks get intermittent pain, classic biliary colic. Painkillers help, but the real fix: surgery. And not just stone removal. We take out the whole gallbladder. That's been the gold standard for around 150 years. People tried removing just the stones, didn't work. It's like plucking leaves off a weed and hoping it won't grow back. Cholecystectomy, the surgical removal of gallbladder, has been around for over a century. But like fashion trends and phone chargers, the how has changed dramatically. We have got from open surgery, think large incisions and longer recovery, to minimally invasive techniques. Now it's all about laparoscopic tools and robotic precision. Smaller cuts, faster healing, and way less drama. It's like upgrading from a landline to a smartphone. Same core function, just sleeker, smarter, and far more patient friendly. Remember that bit about limited options being a blessing? Well, gallbladder treatment is a textbook example. Here, fewer choices actually mean fewer chances to mess things up. For patients who can't undergo surgery, maybe due to poor general fitness or personal reasons, we don't rush in with alternatives. We wait, we watch, but we also educate. Because if surgery isn't on the table, patients must know what symptoms to look out for. Biliary colic or biliary pain isn't just a fancy term. It's the body's way of saying, hey, don't ignore me. Now, there is a medicine that is often requested to dissolve stones. It sounds promising, but before writing a prescriptions, doctor needs to figure out all the details, like what kind of stone it is, how big it is, and if the gallbladder is still doing its job of contracting. It's not a one pill solves all solution. There are caveats, limitations, and a whole lot of ifs. We'll unpack that in our next video, treatment of gallstones without surgery. But here's the gut truth. The most reliable, time-tested solution is laparoscopic gallbladder removal surgery. It's simple, it's effective, and unlike that medicine, there are no hidden catches. When it comes to gallstones, less really is more. And sometimes, the clearest path forward is the only one that actually works. Coming to complicated gallstones. Gallstone complications, we covered them in detail in another video. But here's the headline. Prompt treatment is critical because when things go south, they don't stroll, they sprint. Treatment depends on the type and severity of complication, but the core principle stays rock solid. Get the patient to the hospital, stabilize first, then fix the root cause. The inflammation might come from stones stuck in the gallbladder, the bile duct, or even causing intestinal blockage. Whatever the problem, we tackle that first. Sometimes it's early surgery, sometimes it's another procedure like ERCP. But once the storm settles, the priority is clear. Get that gallbladder out. There is a quote I love from Anthony D'Angelo. When solving problems, dig at the roots instead of just hacking at the leaves. Gallstones are the root, and if you don't remove them, the complications will keep sprouting. Take bile duct stone complications for example. We often use a procedure called ERCP to remove those stones. But ERCP doesn't touch the gallbladder. So if you skip surgery afterward, you are basically leaving door open for a sequel. Still many patients ask, do I really need gallbladder surgery? And some choose to ignore the advice. But here's the thing. Ignoring the root cause doesn't make it go away. We do this in life too. Hate your job? We de-stress with weekend getaways, parties, spa days. But those are just band-aids. Eventually burnout knocks. Gallstones are no different. You can treat the symptoms. You can patch the complications. But unless you remove the gallbladder, the problem keeps coming back. Barring any surgery-related hiccups, gallbladder removal solves the issue permanently. It's not just treatment, it's resolution. Let's wrap this up with a principle that applies far beyond medicine. Root cause analysis. It's not just a diagnostic tool, it's a life skill. Sometimes the solution is simple, straightforward, sitting right there. But if you miss the root cause, or worse, ignore it, you are signing up for a long term mess. Even big companies fall into this trap. Take Nokia. They treated the smartphone revolution like a gallstone, ignored it until it blocked their entire market share. Instead of building a new operating system to join the app revolution, they kept slapping band-aids on Symbian. New phones, same old problem. And eventually, they had to sell their phone business to Microsoft in 2014. The lesson? Whether it's gallstones or global strategy, don't just treat the symptoms. Figure out the cause of the problem and solve it. The most reliable long-term solution for gallstone-related symptoms or complications is gallbladder surgery. Nothing else works. No shortcuts, no hacks, just root cause resolution. Thanks for watching. If you found this helpful, check out our other videos on gallstone symptoms, diagnosis, and complications. Until next time, stay sharp, stay curious, and trust your gut. Bye.